My name is Dr. Richard Geyer from the Texas Back Institute, and today we are talking about back pain.
Should I see the doctor for general back pain?
In most cases, about 70% of episodes of low back pain will get better within just a few days or perhaps a little bit longer. Most of these can be remedied by just resting for a day or two, taking some over-the-counter anti-inflammatories such as Aleve, Advil, or Tylenol, and the use of ice for the first 48 hours, and then one can then use heat. If these don't get better, then one would consider seeing a physician for further evaluation.
What pain characteristics should be of concern and if it to make a good idea to see a doctor?
Well, the warning signals that we always worry about with patients with low back pain are the following. If one has any neurologic deficits such as numbness or weakness or searing pain down the leg, that is more significant. Or if one is having problem with their bowel or bladder control, that is considered to be an emergency and oftentimes will lead to surgery.
And you said the majority of general back pain usually gets better over what amount of time?
Most back pain normally will resolve within the first 2 to 3 weeks, that is about 70%, and 90% will be better within the first 8 to 12 weeks after an episode.
What are some of the treatments for back pain besides surgery?
Well, the vast majority of patients never come to surgery. In fact, most patients respond to non-operative treatment. And the first treatment that we consider doing is placing a patient on oral anti-inflammatories such as Aleve, Advil, or Motrin that can be used on a short-term basis. We also will have the patient begin an exercise program after a few days of rest for the acute episode, and chiropractic is also helpful for the very acute stages.
Do we sometimes give patients injections or anything like that?
Patients will respond to injections if they have signs of unremitting back pain and they have been satisfactorily diagnosed by having at least an MRI scan to determine that they have no other causes of back pain, because we know that there are many other causes of back pain such as intra-abdominal problems that can come from the various organ systems and even from the blood vessels. And once we have an MRI scan that shows that there is not a serious problem and there is no tumor and no infection, then one might consider injections. If it's back pain alone, facet injections into the little joints of the back may be helpful. If it's a disc problem that's putting pressure on a nerve, then an epidural or a selective nerve block may be helpful for the patient.
So bottom line is that most back pain will go away over a several week period. But if you do continue to have progressive pain, then we need to find another remedy. Is that correct?
That's correct. And I would recommend for any patient that does not respond or has recurrent episodes of back pain that he or she should be seen by a physician and treated with the methods that I mentioned above, but also consider going to a physical therapist to be instructed in the proper exercises or core stabilization exercises, as we say. These exercises can also be achieved through the use of yoga or even Pilates, but my recommendation is to see a physical therapist first to be instructed in the proper exercises.